Imagine sitting on a bicycle saddle and literally losing 70% of the blood flow to your most sensitive anatomy in just like 3 minutes.
Yeah, it's really staggering when you look at the number.
It's insane. And for millions of female athletes, that severe nerve compression isn't some rare, like, worst-case medical scenario. It's literally just a Tuesday morning spin
Right,
class.
it's just their normal routine.
Yeah.
We're looking at a state of rapid acute tissue strangulation, really, and it's happening entirely under the radar. People are dealing with this intense localized pain that's tied directly to the activities they love or even just the everyday clothes they wear. They just assume it's normal.
Yeah.
They just accept it. Well, welcome to this deep dive. Today, we are taking a massive stack of medical clinic guides, gynecological research, and cycling health articles to explore a highly specific and very surprising intersection of sports medicine, anatomy, and clothing design. Our core mission today is to answer one really fascinating question. How does a cosmetic-sounding procedure called a labial puff actually serve a critical mechanical purpose?
Right.
We're going to figure out exactly how it reduces that intense discomfort and the pinching caused by tight clothing, swimwear and cycling saddles.
And it sounds like a paradox at first glance, right? When
Yeah.
people encounter the term puff, the immediate association is usually aesthetics or, vanity.
Totally.
But as we synthesize the clinical data and the biomechanical research today, we're going to see that this is a conversation strictly about structural integrity, nerve preservation, and chronic pain management. Okay, let's unpack this, because the sources point out something genuinely heartbreaking to me. So many people, especially women who cycle, who run, do yoga, or honestly who just wear fitted activewear, they suffer completely in silence.
They really do.
They assume this burning, this pinching, this numbness is just the required price of admission, for being active.
Yeah, and that's why knowledge is most valuable when it's understood and applied, which is why we have to kind of strip away the stigma surrounding this specific anatomy. We need to look at the body purely as a dynamic mechanical system that's interacting with external pressures. If we can understand the physics of the problem, the medical solution becomes incredibly logical.
Right. And before we can understand that medical solution, we need to completely map out the mechanical problem. So let's talk about the anatomy versus the bicycle saddle. Like, why does cycling or even just wearing tight compression leggings cause so much physical trauma in the first place?
Well, the conflict really starts with the biological structures themselves. So the external female genitalia, collectively known as the vulva, includes the labia majora, which are the outer lips, and the labia minora, the inner lips.
Okay.
Now, the labia majora are naturally composed of this really dense fatty tissue. And from an evolutionary and biomechanical standpoint, their primary job is to act as a protective cushion.
The cushion, right.
Exactly. They're meant to envelop and shield the highly sensitive inner structures. So that includes the labia minora, the clitoris, and the vaginal opening.
So they're essentially the body's built-in shock absorbers. I was actually thinking about this while reading through the clinical guides. It's basically like a pair of high-end running shoes with those really thick built-in shock-absorbing insoles, right?
That's a great way to look at it.
Oh.
Taking that running shoe analogy a step further, unlike the bottom of a foot, that exposed inner anatomy we're talking about is incredibly vascular.
Yeah.
And it's just packed with delicate nerve endings.
Right, super sensitive.
Extremely. But here's the critical variable that creates the whole medical issue. That outer fatty tissue, the labia majora, it doesn't stay the same forever. Over time, they lose volume and structural integrity.
And what actually triggers that deflation? Like, why does it go away?
It's a combination of factors, really. Aging is a primary driver, and that's heavily influenced by hormonal changes.
Oh, like menopause.
Exactly.
Mm.
The significant drop in estrogen during menopause, for instance, leads to thinning tissues and a general loss of elasticity across the body, but particularly there.
Okay.
Also, significant weight loss can deplete the fat pads there, just like it depletes fat in the face or the breasts. And additionally, childbirth can permanently alter that elasticity. It stretches the connective tissue so much that the volume is either dispersed or diminished over time.
Wow. Okay, so sticking with the shoe analogy, you're suddenly running on hard pavement without that thick outer padding. The sensitive inner structures of your foot are just going to take the full, brutal force of every single bump. Without the labia majora doing their job, the delicate inner anatomy is just completely exposed to external forces.
Yes. And the clinical literature on cycling health details exactly what happens when those specific forces are applied. They actually categorize it under the umbrella of bicycle saddle disease.
Bicycle saddle disease. That sounds intense.
It is. When that anatomical padding is compromised, you're placing the pudendal nerve, which, by the way, is this massive primary nerve supplying sensory information to the entire pelvic region. You're placing it directly against a hard surface.
Oh, wow.
And you are also compressing the local blood vessels that supply oxygen to those tissues.
So it's getting crushed between, like, the pubic bone and the hard nose of a bike saddle, or even just the tight, restrictive seams of a pair of compression leggings pressing upward?
Exactly. The pressure physically crushes those tissues. The sources we have from Cruise Bike and Bicycling Magazine, they highlight these studies showing that sitting on a standard saddle can reduce oxygen and blood flow to the genital area by 70% in just 3 minutes.
70% in 3 minutes. That is, I mean, that's wild. So we're talking about rapid, acute tissue strangulation, not just standard chafing from, fabric rubbing against your skin.
No, not at all. It creates a severe state of ischemia, which is the medical term for restricted blood flow. When the pudendal nerve doesn't get enough oxygen, it begins to misfire.
And that causes the symptoms.
Right. That misfiring translates to sensations of burning, stinging, and profound numbness. And if the ischemia is prolonged, the nerve can actually sustain long-term damage.
So you have this state of ischemia happening in literally minutes, causing this intense numbness and pain. And the cycling industry actually saw this happening in the 90s, right? But they fundamentally misdiagnosed how to fix it.
They did. The history of how this gear evolved directly informs the failure of the design. Standard cycling equipment was historically engineered entirely around male anatomy.
Shocking.
Right. What's fascinating here is the initial wave of studies that prompted the creation of the famous cutout saddle, the seats with the hole in the middle.
Yeah, I've seen those.
They were actually conducted by the CDC on male police officers.
Wait, really?
Yes. These officers were experiencing numbness and erectile dysfunction from just spending long hours riding on patrol.
So they designed a seat with a groove or a hole down the center to protect male anatomy, to relieve the pressure on the male perineum, and then they basically just, painted the saddle pink and marketed it to female cyclists?
Pretty much. And female pelvic anatomy is fundamentally different,
Yeah.
which makes mapping a male solution onto it just a biomechanical disaster. Women generally have a wider infrapubic angle, meaning a wider proportional pelvis. So when a woman sits on a saddle with a hole cut out of the middle, those deflated, unsupported labial tissues do not just hover safely over the gap.
Because of gravity and just the sheer weight of the torso bearing down on the seat, right?
Exactly. The labia actually swell due to the localized pressure, and they get pushed forcefully into the hollow cutout. Instead of relieving pressure, the firm edges of the cutout act like a cookie cutter pressing into dough.
Oh, God. That sounds awful.
It creates incredibly high pressure around the tight borders of the hole, physically trapping the tissue inside the void.
Yeah. The clinical sources document the resulting damage, and it is pretty graphic. We're talking about severe chafing, the trapping of heat and moisture, which, creates a perfect breeding ground for UTIs and yeast infections, and something the medical texts call labial fibrosis.
Right. Labial fibrosis. It's a fascinating, albeit painful, biological defense mechanism. It's a direct cellular response to chronic repetitive trauma.
Like calluses on your hands.
Kind of, yeah. When the delicate inner tissue is constantly rubbed, pinched, and pushed into a saddle cutout, the body attempts to protect itself by having fibroblasts lay down excessive collagen.
Okay.
It essentially forms internal scar tissue. The labia become hard, bumpy, and chronically painful. The sources actually note that some professional female cyclists have been forced into early retirement because this tissue damage and the pudendal nerve pain became entirely irreversible.
That is just tragic. But wait, I'm stuck on the physics here for a second. If the root problem is a lack of space, this cookie cutter effect, trapping tissue, and there's too much friction inside tight swimwear or saddles, how does pumping more volume into the pelvic area not just create a bigger target to get pinched? I mean, it feels like we're adding more fabric to a suitcase that's already impossible to zip shut.
That's a really common question. But that structural distinction is exactly why we need to separate the function of the inner and outer vulva. Adding volume doesn't create more friction because of where the volume is being added and specifically what it is covering up.
Okay, walk me through the mechanics of that.
Sure. So the inner labia minora contain the highly sensitive tissue, the dense network of nerve endings, and the vascular structures that get damaged. When the outer labia majora deflate and thin out, those delicate inner lips are left just dangling and exposed. The structures getting caught, rubbed raw, and pushed into the saddle cutouts.
Oh, I see. Here's where it gets really interesting. The medical solution isn't about making everything smaller to avoid the saddle. It's about actively restoring the shield.
Yes, exactly.
This is where the clinical texts introduce the labial puff, which goes by the medical terms labia majora augmentation or labial fat grafting.
Right. And the procedure works by injecting volume specifically and exclusively back into the outer labia.
Mm,
By replumping the labia majora, you are rebuilding that lost shock absorber we discussed earlier.
okay.
You're artificially restoring the structural fullness of the outer lips so they can resume their biological mandate, which is shielding and enveloping the sensitive inner lips and the vaginal entrance.
So you are putting the thick rubber sole back on the running shoe. You aren't adding material that gets in the way of the foot. You're adding dense material to the outside that absorbs the impact. So the sensitive foot inside never actually feels the pavement.
That's spot on. That physical buffer absorbs the mechanical load. By projecting the outer labia forward, it prevents the delicate inner structures from protruding and getting caught against a bike saddle or rubbing against, say, the stiff, unyielding center seam of a pair of tight jeans.
Yeah.
Most importantly, it takes the direct compressive pressure off the pudendal nerve and the local blood vessels, preventing that 70% drop in blood flow and the subsequent ischemia.
That completely reframes how you look at the procedure. On paper, it sounds like something out of a celebrity gossip magazine, but in practice, it's literal structural engineering for the human body.
It really is.
So if a listener is sitting there realizing that this biomechanical failure might be the exact cause of their chronic spin class pain, what does this intervention actually entail? Like, what happens in the clinic?
Well, the clinical guides detail two primary methods for achieving this restoration. The first method utilizes dermal fillers. This typically involves a hyaluronic acid filler with specific products formulated for this area like Labial Puff, or an extracellular matrix product called Renuva.
Wait, hyaluronic acid, that's the exact same compound people use in facial fillers to plump up their cheeks or lips, isn't it?
The chemical mechanism is identical.
Yeah.
Hyaluronic acid is a naturally occurring substance in the body that is incredibly hydrophilic, meaning it attracts and binds to water molecules.
Okay.
So when it's injected into the labia majora, it pulls in hydration, providing immediate volume, density, and cushioning. And the procedure itself is highly efficient, usually taking about 15 to 30 minutes in a clinical setting under local anesthesia.
Oh, wow. So you're completely awake, they just numb the specific area, and you're done in a half hour.
Exactly. The primary advantage is that immediate cushioning with virtually no systemic downtime. The limitation, however, is metabolic. Just like with facial applications, the body's natural enzymes, specifically hyaluronidase, will eventually break down and metabolize the hyaluronic acid.
Ah, so it doesn't last forever.
No, the physical relief is temporary. It generally lasts anywhere from 6 to 18 months before the mechanical cushioning diminishes and a touch-up is required.
Okay, what is the second option for someone who wants to fix the shock absorbers, but, doesn't want to go back to the clinic for a refill every single year?
The more permanent method is autologous fat transfer. Now, autologous means the biological material is harvested from your own body.
Right.
This process involves a mini liposuction procedure to extract a small amount of adipose tissue, fat basically, usually from the patient's abdomen, flanks, or inner thighs.
And they just inject it straight in.
Not immediately, no. The harvested fat must be meticulously purified first. It's placed in a centrifuge and spun at high speeds to separate the viable fat cells, the erythrocytes, from blood, oil, and any damaged cells.
Oh, interesting.
Yeah, only the healthiest, most robust fat cells are isolated and then carefully injected into the labia majora using a blunt-tip cannula to basically build up the tissue layers.
And because it's your own living biological tissue, it lasts longer than a synthetic filler.
It can last for years, often indefinitely. The body will naturally reabsorb a certain percentage of the transferred fat for a few months, usually around 30 to 40%. But the fat cells that survive the transfer and establish a new blood supply, they become a permanent, living part of the local tissue.
That is fascinating. Now, before we move on to recovery, we need to make a very clear distinction based on the medical texts, because people often conflate this procedure with something else entirely. We have to contrast the labial puff with a labiaplasty, because mechanically they are complete opposites.
Yes, that's a crucial distinction. A labiaplasty is a reductive surgical excision. It involves using a scalpel or laser to cut away and remove excess tissue, almost exclusively from the inner labia minora. It's really about subtracting material.
whereas the labial puff is augmentative.
Right. The puff is minimally invasive, relying on injections rather than excisions, and it is strictly about adding volume to the outer labia majora. Occasionally, a surgeon will perform them in tandem, reducing elongated inner lips while simultaneously plumping the outer lips to create a flush, protected profile. But mechanically, they serve entirely different purposes.
Okay, let's talk about the recovery, because there's always a catch, right? The sources note that the downtime isn't brutal if you're just walking around the house. Patients usually return to light, everyday activities in a matter of days, but there is a massive caveat for the athletes out there.
Yes, the post-procedure protocols are incredibly strict regarding mechanical stress. While a patient might feel perfectly fine walking or working at a desk, the clinical guidelines explicitly forbid heavy sports, cycling, horseback riding, or sexual intercourse for a minimum of 4 weeks.
4 weeks of zero spin class or cycling? Why is the restriction so long if the actual procedure only takes 30 minutes?
Because we're dealing with cellular survival. It's best to think of a fat transfer, kind of like getting a delicate skin graft.
Okay.
The newly injected fat cells are practically holding their breath. They do not have a blood supply yet. They need time to integrate into the surrounding tissue and trigger vascularization, which is the growth of new blood vessels to feed them oxygen.
Oh, I see. So if you immediately jump on a bike saddle.
If you apply intense compressive pressure and friction before vascularization occurs, you will literally crush and kill the newly transferred fat cells before they have a chance to survive. Yeah, and even with hyaluronic acid fillers, early mechanical stress can physically compress and migrate the filler out of place. You just have to let the biological shock absorber cure and establish its blood supply before you subject it to the mechanical trauma of a bumpy road.
So what does this all mean? Let's bring all these biomechanical threats together. Deflated labia majora lose their biological ability to act as the body's natural shock absorbers. When women wear tight athletic clothing or sit on narrow bike saddles, that lack of padding leads to severe nerve compression, a massive drop in blood flow, and intense chafing of the inner anatomy.
Exactly. And we also saw how historical design failures, like the cutout saddle based on male pelvic structures, can actively exacerbate the problem by creating a high-pressure rim that traps and damages swelling tissue, which leads to conditions like labial fibrosis.
Right, which brings us to the solution. The cosmetic-sounding labial puff procedure is actually a highly effective mechanical intervention. By using hyaluronic acid fillers or the patient's own purified fat to restore volume to the outer lips, the procedure artificially rebuilds the anatomical padding. It creates a literal physical buffer that protects the pudendal nerve, prevents ischemia, and shields the sensitive inner tissues from friction, allowing women to actually enjoy cycling, exercising, and wearing fitted clothing without burning or pinching pain.
And I think the most critical takeaway from synthesizing these sources is validation. If you're listening to this and you've been quietly giving up activities you love, whether that's running, horseback riding, or simply wearing your favorite clothes because of hidden, unmentionable pain, you should not accept it as a normal baseline.
Absolutely.
It's not a required toll you have to pay to be active. There are distinct, verifiable biomechanical reasons for your discomfort, and highly effective, targeted medical solutions exist to resolve it.
It really is wild to think about how many people just quietly endure it, assuming their bodies are somehow flawed, when in reality their anatomy is just responding normally to mechanical stress it was never evolved to handle.
And that biological reality leads to a much larger implication. If we connect this to the bigger picture, we've spent this entire deep dive looking at how women are using advanced medical procedures, like extracellular matrix injections and autologous fat grafting, just to tolerate their sports equipment and activewear. But if we pull back, it raises a really fascinating question about the future of everyday apparel.
What do you mean by that?
Well, think beyond the bicycle saddle. If the baseline mechanical pressures of tight swimwear, compression leggings, and stiff denim seams are causing enough nerve ischemia and tissue fibrosis to warrant medical intervention, what does that mean for the future of everyday fashion?
That is a great point.
Are we heading toward a future where everyday clothing, our jeans, our underwear, our activewear can no longer just be designed for aesthetics, but must actually be medically evaluated and regulated for biomechanical safety? If we have to artificially plump our bodies just to safely wear the clothes in our closet, perhaps it's time we demand the clothing industry fundamentally redesign the closet.